Good evening to Mr. Zani, our study skills lecturer, and we are from group 2, which consists of me, Umar Ilham Edwin, Nur Atira, Kashindra Krishnan Balan, and Siti Nur Atijah. Siti Khatijah binti Azman. And we are from the class Sem1C, and today we are going to present our report's findings of Kita Masih Belum Menang by Majalah 3 from group 2. Right, so what is this report is actually about? Let's go. The first one. First is our introduction, which is we want to actually say that the title of the documentary itself is actually aligned with the situation in Malaysia while handling the COVID-19 pandemic, which we will see why. First one, we would like to introduce the background of the shooting location, and it was located in PKRC MIAPS, which is also known as Pusat Kuarantin dan Rawatan Bersiko Rendah. And it was deactivated on 19 July of 2020 when the COVID-19 was believed to be actually successfully handled by the government. But then it was actually opened again in the 9th December of 2020, which is open to treat low-risk patients. And between the buildings of the PKRC MIAPS is a small tent, a small negative pressure field tent, which is called Asmaria, which is used to treat, to stabilize patients of COVID-19 who were in critical conditions before sending them to Hospital Sungai Buloh. And these are the pictures of the PKRC MIAPS, which is the quarantine center for the low-risk patients. And this is the background of the interviewee, the person who was interviewed in the documentary of the Kita Masih Belum Menang by Majalah 3. And the first picture, you can see that is actually Dr. Enkar Singh. He is 39 years old and he is the ICU specialist there. What did he do is that he actually treat the COVID-19 patients, and he makes sure that every treatments and every medicines used to treat the COVID-19 patients are effective to overcome the COVID-19 symptoms. And below him is Jennifer Asha Clement, which is a nurse, and she is actually one of the highlight for this documentary because her emotions were actually real in the documentary. It was symbolized as the feelings of the Malaysians, and her job as a nurse is to actually monitor patients who are in critical conditions. She and her friends, other nurses, are supposed to assist doctors in doing simple procedures such as intubations. It's just simple procedures but she's not in charge in the intensive care unit specialist. So she's just assists in the normal parts of the treatments. And now the modus operandi used to overcome the issue, it will be Siti Nur Khatijah.
My name is Siti Khatijah binti Maksan. So today I will talk about introduction. So for the title of the documentary is Kita Masih Belum Menang, which translates to We Have Not Yet Won. So far, 1.3 is the modus operandi used to overcome the issue factor of COVID-19. For the first case was brought by 3 Chinese tourists boasted by mass religious gatherings, which is more than 1,600 participants. And the political instability in Sabah, election done without safety control and boosted in case of COVID-19. Government action imposed MCO for about 3 months, and the cooperation between authorities and citizens to detect those who attended the mass religious gathering. Royal Malaysian military forces were deployed to assist Royal Police of Malaysia in conducting roadblock. Their daily press conference was done to update on the situation. However, the frontliner, most dominant position in the healthcare line, involved directly with providing treatment to COVID-19 patients. It takes a lot of dedication and work under pressure for a long period of time. Last but not least, public our gratitude to this frontliner who work hard for our well-being. Thank you.
2.0, which is the evaluation part, for me, there are two things that I would like to present. Actually, there are three things, but the number third opinions will be presented by Siti Nur Khatijah. There are two things that I want to present here, which is the first one is Maria could be improved in various ways, and the second one is that COVID-19 destroys the life of everyone deeply. The first one, when I say that Maria could be improved in various ways, is that first of all, what Maria is actually refers to what? Maria actually refers to a 10, which is a negative pressure field 10, which is used to stabilize patients of COVID-19 who are in critical conditions before sending them to Hospital Sungai Buloh. The reason that I say that it could be improved in various ways is that it was only equipped with 4 beds and 6 chairs in the beginning, which is obviously not enough for the patients who were admitted to Maria. And if you can see in the documentary itself, some patients were treated on chairs, which is obviously not comfortable for them. And how did we do to overcome this is that the medical staff who were in charge of the Maria should do a proposal to the upper management so that they could get the funding or maybe a plan to expand their tent or maybe get extra beds or chairs to treat more COVID-19 patients who are in critical conditions before sending them to Hospital Sungai Buloh. And then for the second opinion, which is COVID-19 destroys the life of everyone deeply, I'd like to focus on 3 main characters in the documentary itself. The first one is Siti Aisyah Muhammad, who expressed her grief in being in charge to inform the death of a patient's father that was passed by the patient's brother from another hall. Here, let me explain. Siti Aisyah Muhammad is actually a nurse. She is in charge of the D1 hall, which is a hall for children. Now, one of her patients there, a child, her father, actually died of COVID-19. Where did Siti Aisyah Muhammad get this information? She actually got this information from the patient's brother, who actually has to inform the patient about the death of the father. And we can see that from the Siti Aisyah Muhammad expression, her face and the way her voice sounds, she was actually in despair while she was actually trying to deliver the message to the patient. And this actually shows that it actually tries to the COVID-19 is actually destroying the life of Siti Aisyah Muhammad slowly. It's going to have effect on her for maybe like 5 years to 10 years onward. It is going to leave an impact on her. And the second one is the Jennifer Asha Clement, and her iconic word is sedih lah, which insinuate a deep sadness inside her. While she was only a nurse, but she actually contributed a lot to the patients. She will be the last person to deal with the patients before of their passing away, not the families. And then she'll be holding the phones so that the patient who actually have no chance to survive will be able to call their family who are not able to be there with them in their last moments. And even though her word sounds plain and simple, but we all know that there's actually a deeper meaning, a deeper emotions behind it words. And then the next one is what I want to focus is another patient that was a child at the minute of 28 minutes 12 seconds. And actually in this case, it actually does not destroy their own life, like their own physical life, but the feelings of the mother should be highlighted because the patient is only a child, and at that time we all know that COVID-19 have a fatal impact on child, which is the child could probably not survive that infection, but the mother has to be there to be with her child. And you can see from her faces, her voices were filled with regrets, her eyes were in despair, and she was actually trying to hide her feelings as she pulled up her mask while she was talking to the interviewer. Now, this is just what I want to say. Now we would like to proceed to Siti Nur Khadijah for the 2.3 opinion.
Hello, my name is Nur Atira. I will talk about the frontliner. Who is the frontliner? Frontliner is typically involved in baking and service. In this area, the frontliner is involved health workers, the Royal Malaysian Police, the Malaysian Armed Force, and the Malaysian Volunteer Department. Frontliner members are involved in the treatment and monitoring of COVID-19. Patients are health workers. They are required to wear a special type of clothing called the PPE to protect themselves from infection while on duty. Next is about why the personal protective equipment is very important. The personal protective equipment PPE is very important because to ensure a low percentage of COVID-19 infection when wearing PPE. PPE can protect the wearer from drop, coughing, sneezing, and other body fluids that affect disease patient, as well as contaminate a surface that may affect them. PPE consists of an apron, dress, and shirt, piece of clothing, two-layer glove, and a mask, and the respirator, shoes cover, and goggles. PPE must be worn with proper technique and must be wearing an opening, doffing procedure to prevent the COVID-19 virus from infection any part of the staff. PPE has specific type according to the place and category of COVID-19 patient. The personal protective equipment PPE is usually used in the non-SARI area zone. It can be worn in secondary tree location and yellow zone, such as where subtable for use treating patients who have been infected with COVID-19. Another is the personal protective advice. PPE is used in the area SARI zone. This PPE health workers working in the secondary consultant and trying room do not need to wear the shoes cover, but slightly to those working in nebulization. For who's the working at the nebulization are required to wear the shoes cover because they were in a asthma area. Next type of PPE is personal protective PPE. Used in the area SARI Zone 2. It is used to perform procedures resulting in preserving, monitoring, and taking COVID-19 patients who have been infected. The PPE is have two options, A and B. Actually, it's same, but the difference between A and B is A they wearing with PAPR, but the option B they are wearing PPE with face mask N95. PAPR use has a high cost, and often that one will be the option to wear is PPE each option B. Next is about type of hall used in the MIP by category. Taman Expo Pertanian Malaysia Serdang MIPs have been used as a quarantine place for COVID-19 patients during the pandemic. MIP has opened more additional hall to accommodate the increasing number of new case COVID-19 patients. At MIP have 5 hall have been opened. Among them are Hall A, B, C, D1, and DG. Hall A is for category 1, 2, and 3 patient. Hall B is only for category 3 patient because in Hall B there is have a oxygen supply. Most of these category B patients have pneumonia and needs oxygen. Patients in category 1 and 2 will be housed in Hall C, D1, DG, and F. This new F hall will be opened if the number of patients increase. If the patient in the category B at hall show a decrease in performance, they will give the oxygen first. If they do not show any positive response, they will be taken to the Maria for more detailed monitoring. The patient who is in Maria will be immediately transferred to the hospital Sungai Buloh. The healthy workers on duty at the hospital handling this COVID-19 patient will work 3 shifts. The first shift starts at 9 a.m. until 2 p.m. The second shift will start at 2 p.m. until 9, while the third shift will start at 9 p.m. until 7 a.m. The nurse in the ICU will only care 1 or 2 patients and following by the 1 doctor. This is to ensure that health workers have energy while on duty. The hospital while receive COVID-19 patients are in the Hospital Sungai Buloh, Hospital Kuala Lumpur, and Hospital Serdang. Hospital Sungai Buloh have been a COVID-19 hospital at beginning of the sharp rise in COVID-19 cases. As a result of the increasing number of cases, Hospital Sungai Buloh could not have afford, and the Hospital Serdang and Kuala Lumpur will open to reduce the congestion.
Hello, Assalamualaikum. My name is Tika Masih from class Masih, and I'm here today to talk about conclusion. So for conclusion, since the implementation of the Movement Control Order MCO 3.0, the COVID-19 positive cases have remained alarmingly high. For frontliner workers from different sectors, it remains a daunting challenge. The aspects of life in the pandemic are examined in this documentary, Births and Deaths. The crew of Magazine 3 focused only on forensic. However, this audience will witness the COVID-19 victim body after a mortal examination. This provides information on the effect of the virus on the organs, especially the lungs of the victim body. This episode will describe the psychiatric condition, which is starting to concern doctors with the daily increase in the number of positive COVID-19 children. Next, the magazine at 3-star were also operating in the operating room. Medical personnel in the NICU had research on the early pregnant female who was infected with the COVID-19 virus to save the life of mothers and babies. In this context, they were also exposed to the problem. On the 17th of May, the first series of this patient documentary showed that difficult situation of the ICU personnel and the current situation at the Center of Low Risk Quarantine and Treatment in COVID-19 CQTC. The episode had an enormous impact with a 5 million people source Nielsen audience measurement. The program objective is to inform viewers of the latest trend in the COVID-19 pandemic, which is also contagious in the social media.